Tammy Moss-Chandler. I'm the Director of Health and Human Services for Mendocino County. And I'm sorry we're delayed. We were expecting Supervisor Jarity. He's been delayed at another meeting, so when he's able to join us, we'll certainly have him come up and share some of his thoughts with the group. But I'm actually going to have Janine Miller, our Director of Behavioral Health Services, come and give just a brief overview of our services here in Mendocino County to just remind everyone about the system of care through county behavioral health services in Mendocino County. So Janine, thank you.
Good evening. My name is Dr. Janine Miller, and I am the Behavioral Health Director for Mendocino County. I'm going to start this evening with just acknowledging who our Stepping Up Committee consists of and what departments they're connected to within the county. So first, I have Supervisor Carrie Brown, Mendocino County CEO Carmel Angelo, Judge Ann Mormon, Kim Turner, who is our court CEO, Tom Allman, the sheriff, Tim Pierce, jail commander, Katie Ford with probation, Rebecca Craig, who's a consultant with the county, Beth Norman, district attorney's office, Dr. Gary Pace, our public health officer, Jan McGordy with our behavioral health advisory board, Donna Muschetti with NAMI, Tim Schrader with Redwood Quality Management Company, Mary LeClerc, who's with our public defender's office, Tammy Moss-Chandler, our HHSA director, Randy Smith, our manager for substance use disorders treatment, myself as the behavioral health director, and Dustin Thompson as our support for Stepping Up at this time. Next, I want to talk about county mental health services, where we're really looking at a spectrum of behavioral health services. And a little bit about county mental health services is that we are contracted through the Department of Health Care Services to provide specialty mental health services. Special mental health services are carved out from regular Medi-Cal services and contracted to the counties to provide a mental health plan. We sometimes talk about the mental health system as that the county system provides specialty services. And so the way to look at that is that in the general world, when you'll go to your primary care for most of your medical needs. And when you need the special needs, you'll go to a specialist to get those services. That's how county mental health services are. We are serving the most severe mental health conditions, and those that need a specialist would come to us as they would be considered seriously mentally ill. The requirement for us to provide Medi-Cal services is that you have Medi-Cal and that you have a DSM diagnosis that meets the requirements, and that you have a functional impairment that impacts your daily living, and therefore you would be able to come and see and be served by specialty mental health services. In Mendocino County, we have a unique system in that we are contracted out with an administrative service organization, which is called Redwood Quality Management Company. And that company then subcontracts with contractors within the community to provide the mental health services. The services that Redwood Quality Management Company oversees are crisis response, medication support, outpatient services, inpatient services, and some residential services. The county does most of the conservatorship, Lantred-Petra short conservatorships, which means that an individual is gravely disabled and unable to meet their basic needs, and the county is responsible for providing placement that will allow their basic needs to be met. The county does some additional supplemental mental health services, and then we do contract oversight, billing, planning, and working with the Department of Health Care Services. An additional program that we have within specialty mental health is Mental Health Services Act. It is a Prop 63 that allowed for a 1% tax on anyone that had over $1 million annual salary. And those are additional dollars that can be spent, but they are restricted, similar to specialty mental health services, in that they have to be spent within specific programs. Those programs are really about prevention, early intervention, promoting recovery and wellness, and resiliency. So there's a little bit of a focus and requirement about how those funds are spent, similar to how specialty mental health funds are spent. We also offer behavioral health substance use disorders treatment. We offer those services in Ukiah, Willits, and Fort Bragg. Those services consist of assessment, treatment planning, crisis counseling, individual counseling, group counseling, and discharge planning. And those are also billed through Drug Medi-Cal. So it's a Drug Medi-Cal service. You do have to meet medical necessity to access those services under Drug Medi-Cal requirements. There are a variety of programs that we offer through substance use disorders treatment. We have drug court, outpatient services, jail-based services, perinatal services, and then both in all of behavioral health, we do a lot of outreach, education, and training. Just to touch on a couple of the supplemental services that don't go through special mental health particularly, and they may serve a broader range of clientele, but are funded mainly through grants and Mental Health Services Act. We have our Willow Terrace permanent housing that was just had its grand opening in April and is located in Ukiah. That's a 38-unit apartment complex. One of those units will be housing a on-site manager, and the other 37 units will be available for individuals who have a mental health diagnosis and are homeless or at risk of homelessness. We also have our Round Valley Innovation Project that's been working with the Covelo area and to create a crisis respite and services in that area to focus on crisis and crisis respite. Our full service partnership program is through our Mental Health Services Act. It's a wraparound case management model that we offer. Assisted outpatient treatment, it's also known as Laura's Law, but we do have assisted outpatient treatment in Mendocino County. We had 2 crisis intervention trainings this year for law enforcement and first responders. And we have a 3rd one coming up, and we'll continue to have a couple next year. Mobile outreach and prevention services. We have 3 mobile outreach and prevention teams that service our areas. They have specific areas that they serve. We have a team in North County, one in South Coast, and one in Boonville and Anderson Valley, and they're out working with individuals in the community and in their homes. We have the Whole Person Care project here in Mendocino. It's a grant that allows us to expand services and do a more wraparound model for individuals who have a mental health condition, and not be really allows us to offer services that aren't within a box that Medi-Cal puts us in. We, in the last 2 years, we went ahead and added SGDT services, substance use disorder treatment services, to our county jail. We didn't have those services in the county jail, and we were able to implement services, have a counselor providing substance use services in our county jail, and providing individual and group treatment, and making sure that they're connected to residential detox or outpatient upon discharge. This year we also added a discharge planner. It's been about a month. We have a discharge planner now in our county jail. That individual is working with everybody who walks in the door to see what their needs are. If they have a mental health or substance use disorder that needs to be addressed, they're going to make sure they get those services while they're in custody, and definitely make sure that upon discharge that they're connected to services when they leave the jail. We also have behavioral health court in this county. We have a behavioral health court in Fort Bragg and Ukiah. And we have a misdemeanor competencies to stand trial program that is in our county jail. It is individuals who have been declared incompetent to stand trial can now be treated while they're in the county jail to be restored to competency. The county is only required to focus on misdemeanors. Those that have a felony charge are actually the requirement of the state of California, and they have their own program and their own process. I can say that the Board of Supervisors this last Tuesday approved for a contract to be signed with the Department of Healthcare Services to expand our competency training program to allow for felony restoration in our county jail, which is really a great addition to our county jail. A couple of just things on the horizon for us to look forward to. We have our No Place Like Home grant that will be coming forward that allow us to build more housing for especially mental health population. Drug Medi-Cal expansion, which is going to expand some of the mental health, the drug services within our community, allow more services and allow for residential and detox. And also our Measure B implementation as we look forward to what Measure B brings to our community. And next, I'd like to introduce our CEO, Carmel Angelo. Thank you.
Good evening. This is our last session of 2 days. We had 2 sessions in Ukiah yesterday, and this is our second in Fort Bragg. And we're actually very happy to offer this Stepping Up program on the coast as well. I should speak for myself, not for everyone else, but I don't get out here very often, and so it's very nice that we're able to offer this out here and that we have our speakers here. So I have the pleasure of introducing our speakers, but before I do that, I would also like to thank our partner in this is NAMI, and so I would really like to thank Jen McGordy for all of her work, and I'd like to thank Donna Muschetti for her work. And yes. And you will see throughout the course of the next 2 hours that Donna will continue working. So, anyway, okay, so with that, and then I also don't want to forget Tony Rakes back there, who is taping the evening. So thank you, Tony, for being out here with us this evening. So our speakers are Farah McDade-Ting from CSAC and Elizabeth Siggins from the Council of State Government's Justice Center. So let me tell you a little bit about them, and then I'll turn it over to Farah, and then Farah will turn it over to Elizabeth. So Farah serves as the legislative representative for health and behavioral health with the California State Association of Counties, and very briefly, that's CSAC. CSAC is our statewide association. They represent all 58 counties. And they are our best advocates when it comes to county issues and working with the state and assisting us with those county issues. So Farah specializes in California health and behavioral health services that are administered by counties or have an impact on counties, and has done so since 2007. And prior to 2007, Farah served as a CSAC legislative analyst on a variety of issues, including employee relations, agriculture, transportation, housing, and Indian gaming issues. She began her county career at CSAC in 2001, serving on the public affairs side of the organization as a communications analyst. And before coming to CSAC, she was an assistant editor at the California Journal, which is a nonpartisan government and politics-focused monthly magazine in Sacramento. Farah earned a bachelor's degree in government and journalism and graduated cum laude from California State University, Sacramento in 1999. She lives in Sacramento with her husband and 2 young children and enjoys traveling throughout the state, mainly for work and sometimes for pleasure. Our second speaker is Elizabeth Siggins, and Elizabeth is a consultant on a number of criminal justice reform initiatives in California. And she has worked in the criminal justice field for over 20 years in both government and community-based organizations. She was the director of rehabilitative programs at the California Department of Corrections and Rehabilitation, where she oversaw the rehabilitative programs in over 30 state prisons, as well as reentry programs for those being released from prison. And every time I read that, this is the 4th time now, 30 state prisons. That's pretty amazing. Some of her current consulting projects include working with the Council of State Governments Justice Center on the National Stepping Up Initiative. And the National Stepping Up Initiative is to reduce the number of people with mental illness in our county jails. She also works with the Chief Probation Officers of California on the Continuum of Care Reform and with Californians for Safety and Justice on the Blueprint for Shared Safety. Elizabeth previously worked with the California State Senate and the Office of Inspector General. So please assist me in welcoming Farah to the podium.
Thank you, Carmel, for the lovely introduction. I'm Farah McDade-Ting, and I work for the California State Association of Counties, which you've just heard that name. It's a long, difficult name to spell. Usually we go by CSAC. And I work in health and behavioral health areas. And you've probably heard us say several times already tonight, behavioral health or mental health. And sometimes those terms can be used interchangeably. But when most people are talking about behavioral health, they mean both mental health and substance use disorder services together. And some people that term behavioral health, some advocates in the behavioral health community don't like it very much because it kind of sounds like it's a behavior that somebody can control and, you know, they just need to snap out of it. And so there is some controversy about using the term behavioral health, but when we talk about it in county speak, we mean both mental health and substance use disorder services, and counties are the only ones in the state that provide those services for Medi-Cal enrollees. So it's a really important service for counties. The other thing we see a lot, I see it in Sacramento when I'm working on policy, but in counties as well, is the intersection of mental health or behavioral health with a lot of the big policy issues we're working on. Of course, the criminal justice issue, which you'll hear more about from Elizabeth, and the impact of behavioral health and the criminal justice system and where they intersect, and maybe where we can figure out better ways to not have them intersect as much. Of course, we see it a lot with our child welfare services or child protective services, not only providing services and supports to families or at-risk families, but of course children who are in the foster care system and are already traumatized, pretty much by definition. And then one big issue we work on a lot is on homelessness. And a lot of people, including our current governor, our new governor, and he's learning the lingo. When he talks about homelessness, he does talk about it as if everybody who is homeless has a mental health condition. And that's not true. A lot of them do. In most cases, it's probably about 40% statewide. So there's a big population that needs help that are on the streets. But not everybody who's homeless has a mental health condition. So we try to be really careful about how we talk about that. But again, I mentioned that 40% is still upwards of 50,000 people that need mental health services. Counties, as I said, are the only ones who provide these services for Medi-Cal enrollees. Health plans provide the services for folks who have private insurance. But counties have done a pretty good job, and you'll hear sometimes people say, well, if you're on Medi-Cal, you could get that service. So some of you may have lived experience with that, or needed a family member or friend to have Medi-Cal eligibility to get the services they need. We have a lot of cost pressures on behavioral health in counties. We get our funding from the state, we get federal government funding, and then some local funding. Measure B here in Mendocino County is unprecedented. So this community, besides being part of the Stepping Up initiative about worrying about mental illness in jails, is really shown a commitment to working on behavioral health issues and increasing that capacity in this county. So for this county, it's kind of a special county in that way. In Sacramento, there's always moves afoot to divert funding or say that someone else can do it better, and so we're always kind of fighting against that. But it's also a really good time and an opportunity for all of us, not only as counties, but to work together with our cities, our local schools, because that's where the kids are. The kids need services. Maybe we can partner. And community-based organizations. So what you'll hear from Elizabeth is talking about mainly the criminal justice system and the impact of folks with mental illness on that system. But throughout her presentation, you'll kind of hear about all those entities I just talked about. Of course, counties and jails, but state prison system, schools, community-based organizations, and others. And so the picture is one big collage. Rather than just a certain entity has to step up to the plate to do something. I think you probably heard that when Janine mentioned all the people that were on the Stepping Up committee here in Mendocino, and we're really excited to see audience members tonight to hear about this project. So with that, I want to thank you, and thank you for having me in beautiful Mendocino County. NAMI, Carmel, the Board of Supervisors have been just lovely and so hospitable, and I really appreciate it. Thank you.
Have some slides I want to share, and sometimes it takes a minute for this to warm up.
I meant to turn it on for you.
I
would have remembered.
I actually came over to do it, but the light was on, so I thought, oh, it must be fine. Here it comes. It's coming. All right, thank you. Before I mess it up and turn it off, good. So it's so great to be here. My name is Elizabeth. I also live in Sacramento. And so any excuse to come to Mendocino County is a great one, and this is a particularly important one. Have any of you heard of the Stepping Up initiative, folks? Okay, great, good. And we're a small group tonight, so if something I say as I'm going through doesn't make sense, or you have a question, please just feel free to jump in, because we can do that. So what I'm going to do, so Stepping Up is an initiative that started several years ago. Mendocino County was actually one of the very first counties in California to jump on board, and the Board of Supervisors passed a resolution. I'll explain a little bit more about all of that as we go through. And then part of this effort is really to take some of that work to the next step. With efforts like Measure B coming into place, the county really wants to do some strategic work in figuring out sort of where do we go next. My job tonight is to help you sort of understand how the Stepping Up initiative got started and kind of what we focus on. And so this is actually May is Mental Health Month. And so it's also our Stepping Up Month of Action. So if you're someone who uses Twitter or social media and you want to step up, hashtag Step Up for Mental Health, we'd love for you to do that. And we will definitely be promoting and highlighting the work that Mendocino County is doing with forums like this across. So this work happens across the country, and we'll be highlighting that. Oops, sorry, I think it just flashed on something's up. So let me tell you a little bit about the organization that I work with. The Council of State Governments Justice Center is a national organization, and the Council of State Governments itself actually works on many different issues. It's a nonprofit organization that represents all three branches of government. So it focuses on issues that might affect the legislature, the executive branch, the judicial branches as well. And then the Justice Center is the criminal justice arm of that organization. So they work on things related to the courts, related to corrections, and then as Farrah was talking about, and we've already started talking tonight, have been involved for a while, a couple of decades now, in these where the issues of the criminal justice system intersect with the issues related to mental health. There are lots of resources available. If you work in criminal justice reentry, there's a clearinghouse available on the website, and lots of resources if you want to check it out. So this is what I'm going to talk through tonight. I'm going to start with sort of how did we get here? What does this problem look like? What do we know about this problem of people with mental illness who are in our jails? And then I'm going to explain a little bit about the Stepping Up initiative. It is really based on what we call this 6-question framework. So I'll explain that, and then we'll talk a little bit about potential next steps in Mendocino County and some of the resources that can be available. So we don't actually have great numbers on being able to know exactly how many people living with mental illness are in our jails, and I'll talk more about why that is later. But the estimates are that of the 11 million people who are admitted into jail every year, that about 2 million of those people have serious mental illness. And one of the reasons that we really focus on the jail system in the Stepping Up initiative is because so many more people actually go through the jail system than the prison system. A lot of times, you know, when we're talking about criminal justice reform and stuff, there's a lot of attention paid to prisons. But the truth is, many, many more people go in and out of the jails every year. And so if we really want to impact lives, then that is where we want to do that. Welcome back, Supervisor. So a lot of work, so even though we are talking about this issue a lot now, and I think we see more attention toward this in the media and the public frame, there's actually been a lot of work that has gone into this issue, and counties and state governments concerned about this for a number of years. And one of the things that's grown a lot are mental health courts, and there are a couple here in Mendocino. There's one here in Fort Bragg, I think, as well as in Ukiah. And we've seen a great growth in these mental health courts, and they provide a great point of contact and a great way of helping to get people to the right services. And yet, despite that effort and the growth of the mental health courts, we still see again and again all over the state and really all over the country this reality that jails have become our de facto mental health system. And so really the Stepping Up initiative kind of started because people feeling like, okay, we keep doing what people are telling us to do, we're trying to address this issue, we set up a behavioral health court, and really our sense is that we may have more people than ever actually ending up in jail. And so what are we doing wrong? And how can we do this better? So the reality is that people with mental illnesses are overrepresented in the jails. The estimates kind of range anywhere from maybe 15 to 20%, but in general, kind of the number that people are sort of agreeing on is about 17% of the people who are in jail at any point in time, they have a serious mental illness. And that's compared to just 4% of the general population have a serious mental illness. So definitely we see people with mental illness overrepresented in the jails, and we see a significant portion of those people, almost 3/4 of them, right, also having a co-occurring substance use disorder. And then in addition to that, we know that they may also be facing other challenges, whether it be homelessness or other chronic medical conditions. So part of the challenge here is that this is a really complex issue. It is not just a simple issue and not something that behavioral health courts alone can certainly resolve. So in addition to seeing people with mental illness overrepresented in jails, we actually also see that they have longer stays in jail than the average population. This is a study out of Salt Lake County, Utah, which is one of the counties that's really also working hard on Stepping Up initiative. And you can see the lengths of stay here are almost twice as long for people with serious mental illness. They were trying to figure out, well, you know, how many, it ends up being a very expensive way, and not only very ineffective, but, you know, can really be debilitating for the mental illness itself. And so kind of trying to calculate how can we more effectively use our resources. So in addition to having longer lengths of stay, we also see people not being able to access what we know, the programs and services that necessarily work. So often we refer to these as evidence-based practices. These are programs, practices, services that the research has shown are most effective. And so this chart shows that for the estimated 2.6 million adults in the United States who have both serious mental illness and a co-occurring substance use disorder, so they have both of those needs, just 12% of them are actually getting both mental health services and specialty substance use treatment. Okay, so all of them in theory need this, and so we just see 12% actually receiving them. You can see about a third of them actually not even receiving any treatment at all, and then about half of them getting just the mental health services alone. And we'll talk a little bit about how really addressing all of these needs can be particularly important if we want to have an effective approach. So the other challenge, and the other reason why we believe that this problem is still not necessarily getting better, despite the fact that we've tried things like behavioral health courts, and one of the things we continually see is that we also are seeing higher recidivism rates. So recidivism is returning back into the criminal justice system after someone has left jail. So this is a study of people who are on probation. And what we see is they weren't necessarily more likely to be arrested. So they were arrested about the same rate. Fancy, okay. So people who, these are the dark blue are the people without mental illness, and then the light blue are people with mental illness. So we see that the arrest rate's about the same, but in terms of being revoked after they were on probation for some kind of a violation, we see the rates higher for people living with serious mental illness. And another thing that ends up being really important and is somewhat counterintuitive for a lot of us who've been working in this field. I think there is often an assumption that people are committing crimes because of their mental illness. And so this is one of a number of different research studies that are coming out now that are really important in pointing out that the individual crime, which ends up leading to incarceration, is not always directly related to the person's mental illness. And in fact, what this study found was in only about 7% of the time was there actually what they considered a direct correlation. Now the reason they show it along this continuum is, of course, it's not always just a black and white issue, that something is definitely related to a mental health issue or not. But they did actually include like impulsivity and anger as part of a symptom related to anger management, related to mental illness. So you know, somewhere along in here, they might be counted. So if you were For instance, a direct correlation would be if someone was hearing voices, the voices were telling them to hurt that person, then that is what they would consider directly tied to the mental illness, right? But someone who has a mental illness and was burglarizing someone at a time in which they were having no symptoms, right? That's not related to the mental illness. They have a mental illness. We want to make sure they're getting to the appropriate level of care, but we also want to understand that there are other needs going on and that that crime itself was not necessarily a direct result of the mental illness. So there's sort of a continuum and people follow along that. But I think far too often we sort of assume that all of the crimes committed by someone who has mental illness are directly tied to their mental illness. And this ends up being important because once someone is coming into our criminal justice system, if the only service we then get them is mental health services, we actually might not necessarily be addressing some of those other what we call risk factors that are actually putting them at risk of committing additional crimes, which could end up being why we see then higher recidivism rates, because what we're not really addressing, maybe the substance use need or anger management that's not just tied to criminal justice. Lots of time there can be early trauma, which may of course be intersecting with mental illness but is not, but may be resulting in other issues as well. So there can be a lot going on that we need to understand. This chart doesn't have to be as complicated as it looks, but essentially the point here that is helpful to take away is that what we ultimately, if we're really getting to the most effective system, we want to be addressing kind of the three different things I was just talking about. The risk of someone actually committing another crime, their substance use disorder needs if they have them, and then their mental illness if they have a serious mental illness. And we don't want to just assume that because someone has a serious mental illness, they have all of these other factors too, nor do we want to assume that if they are just low risk, that they don't have mental illness issues, right? And so this is a framework that we would use to say we need to assess each of these things, and there are great assessment tools that are available to help us do that, and identify if someone is low risk to commit another crime, that we don't want them in our criminal justice system. In fact, the research shows that we could actually make them worse and put them at higher risk if we start bringing them into our criminal justice system and they're not really have much, propensity to commit another crime. Likewise, if they're sort of a higher criminogenic risk, sometimes because we have a substance use program and someone was arrested while they were using drugs or alcohol, we then put them in the substance use program, right? And they may not have that need. And so we really want to be able to target people with the services they need in order to be most effective, particularly because in every county in this state, we don't have enough services. So we really want to maximize what we do have and use things like assessments to be able to figure out who those people are and what they need. And so ultimately, we're trying to get to a much more effective integrated system of care. So as I said kind of from the beginning of this section, so counties have stepped up and yet they continue to face challenges. Why is this so hard? And so it's so hard for all of the many reasons that I just outlined. And so what can we do about it? So what does stepping up do? Well, stepping up realizes that for a couple of decades, as people were trying to grapple with this challenge and seeing more and more people with mental illness sort of ending up in the criminal justice system because there weren't other alternatives, that lots of times we were kind of talking at each other, across each other, at different purposes. The reality is that in many places, people who work in the mental health system were not necessarily trained to work with people who start to have criminal justice involvement. There's stigma on both sides of this, certainly. So we're now talking about individuals who are facing not just the stigma of mental health, which is very real and something we work hard to try to address, but also the stigma of criminal justice involvement. And so really trying to narrow what can we do, how can we focus this issue? And so the goal of the Stepping Up initiative is to really focus in on, we want to reduce the number of people who are in jail who have a mental illness. We want there to be fewer of them tomorrow than there are today. And so what do we need to do to get there? These are some of the partners who've been involved in this. The CSG Justice Center, which was up there on the right, is the organization that I work with. The NACO is the National Association of Counties. It works with the State Association of Counties, that's the national group, the American Psychiatric Association Foundation. So these were the three groups that got together 4 years ago and said, we need to make this happen, we need to help counties and figure this out. As you can see, NAMI has been one of the lead steering committee members from the beginning, has been very involved in this effort. And many California counties have stepped up. I already told you that Mendocino County was actually the first one to do so. And so there's lots of work that's going on here in California and trying to address this issue. So the Stepping Up initiative is based on 6 key questions. They're pretty straightforward and might in some ways be useful for almost any policy issue we're trying to tackle. The first is your leadership committed? We'll walk through these in a minute. Do you have timely screening and assessment? We already talked a little bit about that. Do you have baseline data? So you say this is a problem. Well, do we know what the problem is? And how will we know if it's getting better if we don't actually know what our baseline is right now? And so that data issue ends up being a real one. Have you really done an analysis of what currently exists and what your processes are? Like, do you actually know? And we find this all the time that working with, one of the things I get to do is go work with different counties, and we'll be sitting in a room and, literally, 2 people from the same county don't realize what's available. And so I've never come across a county where it turns out there are plenty of services, but there is often not a full understanding of everything that is available. And also when you bring people who work in different disciplines together, you can think about how to solve these problems in a different way. And really understand what is available. And it's really important to have all of the service providers engaged in that, because of course we know as county government employees, we don't always know everything that is going on. And then from that information, you can then prioritize your policies, your practices, and your funding. And then, of course, we want to track progress and see if we're actually making the improvements that we're hoping to do. So like I said, we will walk through these. We actually kind of started doing a little bit of work on number 4 over the last couple of days, kind of the longer afternoon sessions that we've had. People came and really began to kind of map some of that out. And so if you signed in, we'll actually be sharing that information, and I'll explain a little bit more about that. So these 4 measures are really probably what's key to the Stepping Up initiative. And so there are the 6 questions that we want people to walk through, but this is really what we want people to focus in on. Because if you want to make a difference, if we want to make a difference, then we need to know if we're actually having an impact. So this one is kind of what we've been talking about, reducing the number of people who have mental illnesses who are actually booked into jails. But you can imagine that there might be a number of ways in which you could do that might not be good for people living with mental illness, right? If we're not just getting them out of jail and into the appropriate level of care or accessing the right kinds of treatment, then we could see their mental health issues getting worse and probably their criminal justice involvement escalating as well. So we have to look at all 4 of these. I talked about the fact that we also see longer lengths of stay for people with mental illness. So we don't want to find that we've reduced the numbers, but the people who are there are staying much longer, right? So that also becomes incredibly important. And we need to make sure that we're actually increasing their connection to treatment. Again, we don't want to just be diverting them out of the criminal justice system into nothing or unsafe places. And then, of course, we want to be watching recidivism rates, and again, recidivism meaning coming back into the criminal justice system. So those all become really important and are key to this. The problem is these aren't that easy to collect. And so really a lot of Stepping Up ends up being about how do we collect these, how can we find a way to meaningfully collect them. And we'll talk again about that in just a moment. But so you can imagine, things about as your leadership committed, stepping up, this issue is not something that one entity can solve alone. County mental health cannot solve this by itself. We need the sheriff's department, we need the probation department, we need the service providers, We need the police agencies, right? Everyone is involved, everyone has a piece of this. And so the Board of Supervisors has passed the resolution. The voters have made it clear, they've passed Measure B, right? This is something people care about. So we've got this interest, we have to keep everyone engaged in the process. And you also have to have things, as you can imagine, like a dedicated project coordinator and things that keep a project like this on track. One of the things that ends up happening at all levels of government is we've got a lot of priorities, we've got a lot of things we're working on. This needs to be somebody's focus, and that's one of the things we learned from this work. A lot of times, kind of before the Stepping Up initiative, often you would have sort of the behavioral health court judge, the mental health court judge, who might be someone who's really become a strong advocate in the community because they're the ones who are seeing every day what's happening, and they're the ones who get, kind of about nowhere to send this person, and they're trying. Their family's coming in, they're trying, what do we do? But that person has to go back to court every day, right? They can't be out there convening the meetings and solving the problems. And so this is really about having people dedicated to doing that problem solving and pulling people together. So I mentioned a little bit about assessments when I was talking about really wanting to understand sort of what is someone's mental health need, but also knowing sort of where their needs for substance use disorder treatment, as well as what's their risk of committing another crime. So what we need to have are common definitions and abilities to screen and assess people for this. One of the things that we find is that a lot of times people are just doing like a suicide risk assessment for people who are booked into jail. That's very common, but that screening in and itself is not really enough to know if someone has mental health issues. But this doesn't mean that you have to have a nurse or even any healthcare professional do that initial screening. That initial screening can be done really by a custody staff as well. It can be done as part of the intake process. There are a number of screening tools that are available. They're in the public domain, so they're not expensive. They can be used for free, and they're relatively easy. Now that's the screening process. That's different. So then if someone screens as potentially having a mental illness, then they need to be referred to actually have a full clinical assessment done by a healthcare clinician. And ultimately, we want to get to a place where this data is then electronically collected, because we can use that then for information sharing and really do much more collaborative work, and we can also use it for the data collection that I've talked about. In places right now in Mendocino County, I know they were just working with the Sheriff's Department, they had them go through and they were able to hand count some of this, right? Which is really useful and can be helpful in putting together some baseline data. And many counties are doing that same thing. But what we want to do is get to a place where we actually can collect this electronically. And I talked before about sort of the difference between screening, which is something that kind of gets done initially. It can be short. It should happen to every person who walks in that jail. That's really our very, very strong recognition. How are you going to know how many people came into your jail with a mental illness if you don't actually screen them? People are using things like, well, those who are on medication. Well, if you know anything about mental illness, you know that there's a chance that someone who has a mental illness is not on medication, or that when they come into jail, you're not going to know that they were on medication, and that their medication prescribed to them. So, there are different proxies people can use. I said that many use a suicide assessment, but really, what we want to do is a short screening tool for everyone who walks into that jail. Will really help get us a sense of what the scope of this challenge is. And then the assessment is the longer process that we actually use to treat and to diagnose and treat. And so this is an example of how Salt Lake County, Utah, I mentioned before, has actually taken a bunch of their assessments for each of these different things and has really started to now use it in a much more integrated and effective way. So you can imagine before that this is what they used for that mental health screen, which I was just talking about. So before, that was not given to everybody. And then this is kind of what they use as their risk assessment. This is a common risk assessment tool. Many probation departments use it. But that might have been done only by probation, and only probation would look at it for people who are already on probation. And then a drug screen might have been given to people who once were sentenced to jail and are going to be there for a while, right? But not everybody got it. This is a pretrial risk assessment, so if you're determining whether or not someone is in jail, do they need to stay in jail while they're awaiting their hearing, or can we actually let them go home? And so that's often done, maybe by probation, maybe by pretrial services, maybe it's only the judge who ends up seeing that. And then, sometimes you'll have assessments that are done that no one looks at. So really trying to take all of these, then sharing this information, and of course this often comes up, well, you have all kinds of HIPAA requirements and limitations, but we've really been working with people to understand that a lot of times those limitations are not as severe as people think they are, that there is a way to share information for case management purposes and other purposes. You don't necessarily have to be sharing a diagnosis, you can be sharing other information that is helpful, and then you can use those decisions, everybody can be using those decisions to inform all of these important decisions, instead of everyone starting this process all over and doing their own pieces of it. Okay, so baseline data, question number 3, do you have baseline data? So these are the 4 areas that we talked about, the people who are booked into jail, how long they're staying, what percentage are actually connected to care, and then what is that recidivism rate. So those are the measures that we care about. Oops. And so you can imagine that one of the reasons that we care about these is because, let's say 2 are going down but 1 is going up. Well, then that can help you really figure out, okay, if it's the average length of stay that is going up, what are some of the things that we can do to address that, right? And again, this problem is big and it's complex and it touches many different fields. And so that can give us a particularly tough time in addressing it in this strategic way. And so if we have the data and we're all looking at the data and we can all say the same thing, then you don't end up with the sheriff's staff saying, well, we think this is the problem, and the behavioral health staff are saying, we think this is the problem, and the families are saying, we know this is the problem. You end up really being able to say, okay, folks, this is where the issue is, the data is showing us this. And everyone can be on the same page and working from that point of view. This is the step I talked about that we did a little bit with today. So this is the comprehensive analysis and service inventory. So really looking at what is currently available and what are the processes that are in place or not in place. So for example, one of the things that came up yesterday when we were talking about this was, what do you do when you want to call, but it's not really a 911 emergency, but crisis line isn't really right either because the person doesn't necessarily need to go to the emergency room, So what's the process that should happen for that, in that instance? We talked a little bit about, other training that could happen for the people that are at 911 dispatch. So there are different examples that you can, when you're walking through this process, and so the last couple of days have just been kind of the very beginning of starting to map that out for Mendocino County, and then they're going to take that information. I think I have a couple other slides. They're going to take this information. If you signed in, they'll be pulling it all together and coming up with some other ways of getting additional information. And actually during our question and answers later, if people have specific things that I've been waiting to say, why don't we do this, please let us know. We don't have time tonight to do a whole process with this, but we'd love to hear any ideas that you all do have. Sorry, I didn't tell you what this was. So many counties have started this mapping process, have been doing this. This is an example of LA County. So not a simple map. LA County's process may even be more complicated than this, but the truth is everywhere, regardless if you're a large or a small county, kind of as we've talked about, the process can be complicated because there's so many different decision points and so many different people who have the discretion at these different points to make decisions. So anytime we map it out, it actually ends up being complicated and it's helpful to have everyone do this. Santa Cruz County, this is kind of the way they started doing some of their mapping, kind of putting it into a few different buckets. We did something kind of a little bit of a cross between these two, actually. This was Yolo County, and so you don't need to be able to see the details, but just so you have a sense of kind of what I'm talking about, it really starts with this is the incident occurs. And so then they talk about, well, does the person go to the emergency room? Do they go home, or do they get booked into jail? If they get booked into jail, then do they end up in arraignment? Do they end up getting sent to the ER, or do they end up getting released and sent home? Once they're arraigned, really tracking how many days do they spend in county jail. These are some of the different services or programs they might have received there, you know, and then it kind of keeps going, walking through the process. And again, kind of a simplified version, but really kind of walking through. And at each step, what you see here is sort of here's what's available. I think, you know, the blue are some of the processes that are in place that seem to be helpful. And then they started to identify, you know, here's where people get stuck, or here's where we have a big hole in the system. When you start doing that, you can really see, oh, if we could address this gap here in the system, it would help keep everyone from just sort of funneling through. Because so often, unfortunately, it's not till you get down here that's really where we have the clinical services. And so what can we do to make sure that people are accessing treatment and getting the medication support and other things much, much earlier, and not having to get so deep into the criminal justice system? And then we use that information to prioritize the policies that we make, the practices that we put into place, and the funding decisions. Always looking back to those 4 measures, so saying, hey, we want to try this. Is this going to help with one of those 4 things that we've decided that we really care about? This is an example of how a California county decided to do this. You can see in this box here, these were their 4 measures of the baseline. So these were the number of people admitted a day. This was the average length of stay. This was 55% of them connected to treatment, and with a recidivism rate of about 50%. So they had limited resources. They decided our goal for the first year is really going to be to try to reduce admissions by 10%. So we want to bring down the number of people who are coming into jail with mental illness. And so they had gone through that process mapping that we were just talking about. And one of the gaps that they found was they had what's called CIT training, crisis intervention training, and you all have started that here in Mendocino County, where law enforcement, sheriff, police department, officers are trained in how to respond when they're going out to a call with a person who has mental illness. So they've done that training. The problem is CIT officers were only available at certain times of the day. They weren't available all the time. And so they went back in and looked at the data of the calls coming in, and when were the calls coming in where they didn't have CIT trained officers, so they could really figure out where the holes were that they needed to fix. And so then that was the idea. In order to be able to, then they figured out what funding do we need to be able to do this, and move forward from there. What will we track specifically to know if this approach is working, etc. So it really can be used to help prioritize problem solving. And then, yes, of course, we need to track progress, so we in fact know that it's working, and having all kinds of ongoing evaluation and making sure that we're looking at this regularly. So just quickly, to think about next steps in Mendocino County, and this is where, if you all have any thoughts when we get to question and answer, it would be really great to get your thoughts. So as I said, we did a combination of kind of a couple of these different mappings, and so this is what we'll be gathering information on and putting together. So we looked at prevention intervention. So what's available or should be available, where are gaps, where are people getting stuck, in terms of before we would ever need any law enforcement contact. So these would be things like what's available or not available in the schools, about housing, supportive employment, trauma-informed, really responding to that early childhood trauma, or PTSD, other things. So what do we need to do so that we don't even end up talking about this as a criminal justice issue? What would be available? And again, we were looking all along at every stage at both the assets and really kind of, hey, here's what's great and where are the gaps. And a lot of times what we find, right, is they're assets, but they're not enough, right? They might be geographically missing. They might not be culturally responsive for certain groups. They might be limited in their time. People with justice involvement can't actually access them. We'll find different things like that. The next phase then was, what do we do once an incident actually occurs? So this is where we talk about things like when you call 911, or are there alternatives to 911? Are the law enforcement officers trained in this crisis intervention? Do law enforcement have anywhere else that they can bring someone besides the jail, right? Often we hear from police officers, I know this person doesn't need to go to jail, but I have to take them somewhere. And then, and so this is, what can we put in place to address that? A number of counties are trying some what we call law enforcement assisted diversion, which is before anyone gets booked into the jail, they don't touch the jail, but they take them to a local service provider. So putting something like that in place. The next phase is jail booking and services. So then this would be, what happens after someone is brought to jail? Do we have that universal screening using a validated tool, which means we've really checked to make sure the tool's working in our county the way it's supposed to? Are we getting people to the programs that they need? What other things are working and not working in the jail? The next step is diversion, which means diverting people out of the system. So they get booked in the jail, but maybe I talked about, they're really low risk to commit another crime, and there are assessments that can tell us that. So do they really need to stay in jail? But if we're not going to keep them in jail, where can they go that is safe, where they're going to be able to get the services that they need? How do we set that up? And then adjudication, which is essentially another word for sentencing. What kind of options do we have that will be appropriate, that will address both accountability for a crime that was committed, as well as really help get someone that's treatment and the services that they need. And then what do we have available or not have available in terms of the post-release after they've left jail and connecting them to treatment? This is where we look at the kinds of things we were talking about in terms of not just addressing mental health needs, but also potentially substance use treatment needs, criminogenic needs, maybe family reunification, all kinds of other needs that could potentially be coming in place then. So definitely looking for information to really put a comprehensive map together for Mendocino County. And then I just have a few slides for those of you who are interested and want to learn more, if this applies to your work or your life, or you're just kind of interested in these sort of things. There are a number of resources available on the Stepping Up website. It's stepuptogether.org. There are toolkits, webinars for each of those 6 steps. There's a webinar that might have 1 or 2 counties from across the country talking about how they approached it. There are all kinds of things. We did a whole effort last year to get people together to talk about what would that shared definition look like in California, kind of trying to use some of the California regulations, but so that people in these different fields would have a sense of what that they're not talking over each other, that they're using kind of the same language, and so that's available on the website. As well as a whole bunch of different briefs on the things I've talked about, like these screenings and assessments. There's a self-assessment that counties can do to sort of, hey, where are we with these 6 questions and the 4 measures. There's a handbook for the project coordinator, which can actually be interesting to go through. There's information about different funding streams and different funding sources that could be potentially available for different interventions and things that people might set up. So a ton of resources on the Stepping Up website. And as I mentioned at the beginning, this is the Stepping Up Month of Action. And so there's also some, little logos that you can use on your Twitter site, and et cetera. So we'd love for you to step up for Stepping Up this month and join us in really making a difference to reduce the number of people with mental illness in our jails. These are the activities we're doing over the course of the month. Thank you very, very much. It's great to be here.
Thank you, Elizabeth. I want to ask Donna Moschetti to join me up front so that she can share a little bit about NAMI in Mendocino County. And I just want to join Carmel in thanking NAMI for hosting these events the last 2 days and all the great work you do in Mendocino County. Thank you for sharing with us tonight a little bit of the real-life experience that goes with the data and information that Elizabeth shared today.
Thank you. Thank you. My name's Donna Muschetti. I'm chair of NAMI Mendocino, which is your local affiliate for the National Alliance on Mental Illness. We, thanks to Mendocino County Behavioral Health, Mental Health, and Tammy Moss Chandler, Janine Miller, we actually have an office in Ukiah. We've been around since 1992 in our county, and finally in November of 2018 we opened our office. It's at 564 South Door Street, Suite E. We have a comprehensive mental health library. If you're ever over there, please stop by and check out a book. We provide family-to-family, peer-to-peer, family support group, and peer support group. Family to Family is a 12-week educational course for family members. We offer that in Ukiah right now only, once a year. We have peer-to-peer, which is the same except for peers. That is offered in Ukiah and Fort Bragg. And we have Connections, which is offered only in Fort Bragg. You guys are ahead of us there. And not in Ukiah, but should be starting shortly in Ukiah. And we have Family Support Group both in Fort Bragg and in Ukiah. So that's a little bit about NAMI. If you ever have my cards are in back, NAMI brochures are in back, please feel free to call us anytime. My story. Mine is my godson. His mother suffered from schizophrenia from the time she was 18 on, and in the early 90s to the mid 90s, she was in and out of jail constantly. And unfortunately, in 1997, she committed suicide. Boy was fine until the week between December 26th and December 30th of 2008. He had his first schizophrenic break. His grandmother knew exactly what was wrong with him and tried to get help, and unfortunately at that time there was no help forthcoming. On September 27th, 2009, he had his first encounter with law enforcement. He was arrested for resisting arrest and sentenced to juvenile hall for 3 days. In October, he was walking down the middle of the street. A police officer came up behind him, scared him, he took off running. It was a very bad experience. He was sentenced to juvenile hall for 14 days. In February of 2010, he was arrested for trespassing, and he was sentenced to juvenile hall for 5 days. In April of 2010, he was arrested on a parole violation, and he was sentenced to juvenile hall for 35 days. So in 7 months, he spent 2 months in juvenile hall, rapid, 4 times. He finally received help. He was 5270. Finally got it, 4th time. That's how long it took me. And spent 28 days in Vallejo. He ended up with an excellent psychiatrist who brought in 2 other psychiatrists, and they got him on the right cocktail. He came home in June 13th, 2010. It is now May, what is today? The 9th? It's May 9th of 2019. Since June 13th of 2010, he has not had one single encounter with law enforcement. So that speaks to me. He has an excellent support system. His grandmother knows mental health inside and out. He has an excellent psychiatrist who kept him even though she's pediatric and he's aged out. He trusts her, she trusts him. They love each other, it's great. And so with the right help, he's med compliant, 9 years, no experience with law enforcement. That's my story. Wow. John Wetzler, please. Public speaking's not my forte. Thank you.
Thank you, Don.
John, do you want to put it into the thing about quality?
Yeah, thank you. Well, that way or snap it?
Just snap it in, yeah. There you go.
Okay, how's that? Don't need that either. My name is John Wetzler.
My wife and I are the parents of a seriously mentally ill adult daughter who suffers from the effects of paranoid schizophrenia since 2010. Our daughter is presently living in Napa State Psychiatric Hospital. After multiple jailings, hospitalizations, panic attacks, criminal and misdemeanor behavior, she was incarcerated in Mendocino County Jail on December 21st, 2018 for a felony violation. During a related court appearance, Judge Brennan questioned our daughter's competence to stand trial and ordered psychiatric assessments by Dr. Kevin Kelly of Mendocino County and Dr. Katie Mazarol, Director of CONREP of Sonoma County. The results of these evaluations found our daughter incompetent to be able to stand trial. This was here in Fort Bragg. Our daughter was then remanded by Judge Brennan of Fort Bragg, 10 Mile Court, to the State Psychiatric Hospital System. Well, one may be ordered to the State Psychiatric Hospital System, but before you get there, you must wait for a bed to open. In this case, that wait took 125 days of my daughter languishing in solitary confinement in the Mendocino County Jail. December, January, February, March, April. Where does Judge Brennan think the defendant is during this time? In a state hospital? I don't think so. Are the judges aware of the lengthy and torturous wait? I think some of them are, some of them aren't. To make real what we know our daughter's incarceration, here are a few stark realities. She was confined for 23 hours a day in concrete walls and a steel door with a small glass panel, with one random hour between approximately midnight, 1 or 2 a.m. The nightly release for a shower and an attempt to collect calls to our home. Not one day without sunlight or fresh air. When we visited, she was brought in with her ankles in chains and her hands zipped locked behind her back. This was for 125 days. These are just a couple of the images to carry with you. When hearing this, the universal response has been, I would go crazy if I were in solitary. Can you imagine what this has done to someone already ill and suffering panic attacks? Hearing voices with difficulty submitting to protocols. We are asking very compromised people to endure what would bring even healthy people into crisis. Our own daughter's release from county jail and transport to Napa State Hospital as a bed had opened up. She arrived having lost 20% of her body weight during solitary confinement. Solitary confinement of the seriously mentally ill only traps them within their own echo chamber. No external feedback, no one to return the ping pong serve. For those of us living a free life, not encaged, communicating with our incarcerated daughter became more and more difficult during the 1 hour weekly allowed visits. Hard to comprehend the language and the thought process of one so isolated from society. With her psychosis untreated and florid, she left the jail with her psychosis and psychotic untreated and florid. She left the jail with her version of her psychosis cemented. Now she is at the state hospital where she will be treated as a psychiatric patient. Upon her arrival, she was overwhelmed by the blue of the sky, the green of the grass, and the aroma of fresh air. People were being kind to her, she said. While at the hospital, all criminality has been abated until the defendant is deemed restored to a level of competency to answer to her charges. She will then be returned to the same Mendocino County jail cell to again await court dates to determine a suitable punishment for acts committed while suffering from a mental illness. The court may order a sentence of probation to ensure the patient remains street drug-free and obey doctor's orders, or she may be set free to roam the streets of the county as the judge will consider time already served as an adequate adjudication. She may be deemed a candidate for behavioral health court, where she will have some supervision to help her stay on the straight and narrow. She might become a candidate of Laura's Law. We can only hope that these services will be provided by Mendocino County and paid for by MHSA funds. Our daughter will need housing, SSI restoration, and close observation from her outpatient services if she is to successfully return to society. In conclusion, it is clear that in spite of families and community begging for help for their seriously mentally ill members, criminality is often the only road towards psychiatric treatment for the seriously mentally ill in this state. We need psychiatric hospital beds and facilities to be constructed and served throughout the state. In Mendocino County, we need to actualize the promise of Measure B, approved by 83% of our voters. As long as the jailhouse becomes an extended stop for the seriously mentally ill, success in treatment will be severely limited. It is important to remember that our daughter was not sentenced to 4 months in jail. She was ordered to the state hospital for restoration of competency to answer to her charges. The solitary confinement and nonspecific open-ended incarceration was the actual byproduct of the lack of adequate hospital beds common to all Californians, not only citizens of Mendocino County. We need to exert a unified demand for humane, appropriate treatment that has a chance of restoration for competency and health for those suffering from a mental illness. I have a little addenda here that I put together, and also done a Freedom of Information Act request, which has not arrived yet. So I just had a few of my own statistics here to consider tonight. 90% of patients are forensic commitments to the state hospital system. We're talking about forensics here now. Civilly or criminally mandated to the state hospital system. All have been accused to the criminal courts of crime linked to their mental illness. The remaining 10% are sexual offenders or civilly committed Landerman Petra short 1 year commitments. Presently, there are 39,250,000 people living in the state of California. The incidence of seriously mentally ill, incapacitated by their disease, is 1 in 25, or 4%. 4% of 39.25 million is 1,570,000 seriously mentally ill people. There are 5 forensic existing state psychiatric hospitals in Napa, here in Sonoma County, Los Angeles Metropolitan, Patton, near San Bernardino, Atascadero in San Luis Obispo County, and Coalinga in the San Joaquin Valley. Their total bed capacity is approximately 5,000 to 6,000. A gap of 1,564,000 beds presently occurs. This profound shortfall of beds affects the well-being of our entire society. We must stop the disinvestment of care for our mentally ill and demand a reversal to investment with facilities and providers. We need a more bright future. Thank you. Oh, I also have a couple of letters from people that we're familiar with who asked that I bring them to this meeting. One here is from a friend. I'm here to put a face on this crisis. I have shared our family story. Another friend's son was finally 5150, then 5250, but released many days sooner than the psychiatric health facility Respad in Red Bluff was authorized to keep him in. Within 2 days, this completely disillusioned SMI man was back in Mendocino County Jail, acting out during a court appearance where he would now sits again in solitary. He needs to be hospitalized, not jailed. We need SB 640, which will provide more grounds and a broader reading of the 5150 law and help to get ill individuals off the street. However, the destination needs to be the hospital, not the jail cell. Another friend writes, their son sat in solitary for 4 months awaiting a bed in the Atascadero State Prison. This crisis is statewide. Thank you.
Good evening. My name's Jen McGordy, and I'm here to share my story, not my whole story. I'm chairman of the Behavioral Health Advisory Board, and I follow in the footsteps of John Wetzler. So I want to talk to you about my son's experience in the county jail here in Ukiah, but my disclaimer is that this took place in 2012, and some things have changed. There's more services available now, but I also want to mention that he had private insurance at the time, and the disparity between private insurance and Medi-Cal is huge. There's essentially no services for private insurance people. So when my son was a young adult, he had had some setbacks in his life, and he was seeing a counselor in Santa Rosa. His behavior had become more and more erratic, and one day the counselor asked me if he'd had contact with law enforcement. I was very surprised. What does law enforcement have to do with this? Well, silly me, little did I know. My son was prescribed a variety of medications during this time, but eventually he stopped taking them. So, for your information, and probably if you're a clinician you know this, but the psych meds can be very tricky. And an individual must weigh the cost-benefit ratio of med compliance if the side effects are really severe. So my son stopped taking his meds and became increasingly violent, and we had to call 911. So I must say we had a good experience with the sheriff's deputies that came out. They talked to us first, and then to him, who was not out of control at that point, and said they would take him to see a nice lady. And what they meant was he was going on a 51 hold for a psychiatric assessment. In summary, he was hospitalized 3 times. We had to kick him off our property because of his violent behavior and his refusal to be treated for his illness. He became homeless, but not for long, because he finally lay down in front of Safeway and wouldn't move. So the law enforcement came and he was booked into jail for some misdemeanor charge. The public defender took his case herself. Not too much later, he was released from jail, and right away I got a call from her. She said he had been released, he'd gotten his hands on some alcohol, and he'd been rearrested at St. Mary's School. I don't know if you know Ukiah, but this was very puzzling to me because I knew he didn't have any money. So he didn't have any money when he was released for jail. And there are no liquor stores between Behavioral Health on Dorr Street and St. Mary's School, which is like a block away. So I asked him about this much later, and he told me that Behavioral Health had picked him up and taken him to their office on Dorr Street, and then they told him he could leave. And I told him they thought he was drunk when he was arrested, and he asked if there was a breathalyzer test. Well, silly me, I hadn't thought to ask that. He thought of it. He said he was psychotic, and he didn't know what to do. So you remember he was released with no place to go and no plan. So we went into the office of St. Mary's to ask for help. So we ended up in jail, where he stayed for 6 months, 180 days. And he still refused to take his meds, even though I spoke to the jail staff frequently, and I took his meds to them to administer. But they told me he was provoking other prisoners, so they had to place him in solitary confinement for his own safety, where he quickly decompensated. He lost a lot of weight, again. He wouldn't eat because he hallucinated that there were worms in the food. I wonder if she thought that, or really, maybe there really were worms. And he generally refused to see me when I went to visit him often because he didn't want to leave his cell. When he appeared in court, chained and dressed in orange, he was completely unkempt and laughing hysterically. The judge ordered meds, but they were not given. The judge ordered competency, but surprise, there were no beds available in the state. Finally, he was given court-ordered medication and had an immediately positive response. All charges were dropped after 6 months, and the judge asked him what he wanted to do. He asked to go to a hotel room, but Behavioral Health took him to a homeless shelter here in Fort Bragg, even though he was conserved at the time. He became med compliant with help, I had to call behavioral health here to get them to get help, and he began his road to recovery. So as a result of our experience, I've become a rabid advocate for mental health services, which are still pretty abysmal. I am very hopeful with the goals of the Stepping Up initiative for jail diversion. The process calls for collaboration across a broad array of public systems which currently act independently. Currently, each system has its own set of rules, written and unwritten, and its own data management systems, but each is separate from the other, and there is little, if any, communication between them. This severely affects people's lives. When someone is suffering from mental illness, they are often traveling a quagmire of obstacles that ends in the prison system. So by default, with no other place to go, jails and prisons have become the new mental institution, as Elizabeth said. The only metaphor I can think of is like an automobile. If your car isn't working, you take it into the shop, and the mechanics fix the part that has a problem. The transmission, the brakes. This is like if someone has a certain ailment, a physical ailment, like a heart attack or cancer. One goes to their doctor, one goes to the emergency room, goes to the hospital, sees a certain specialist who addresses a problem. And your family and your friends gather around with their thoughts and prayers for support. In contrast, with mental illness, it's like taking that automobile into a shop where it is completely dismantled. The brakes may be fixed, but the tires are over there in the corner. The chassis is lying by itself in the middle of the floor, but the body is somewhere else. There's no way that car is going to move out of the shop on its own volition, even if all the pieces were in working order separately. This is what it's like going to the emergency room for help with mental illness. Even though the hospital may claim its vision is to improve physical, mental, and spiritual health and make care more accessible and affordable, they really don't want to see mental health patients. They can either send them to the psychiatric hospital, they can send them to the street, or they can end up in jail. And family and friends shy away because this is really embarrassing. So to me, this is what the mental health system looks like. Surely there is a better way. Our society has become very compartmentalized, but we need to find a way to come together for the betterment of mankind. Nowhere is this more apparent than in treating mental illness. If people need help, they should be able to move seamlessly from one public agency to another in a coherent manner. All of these agencies are there to serve the public and to serve society. People must be able to get medical help for a mental illness just like any other disease. People suffering from mental illness must be diverted from the dead end of our default mental institution, the prisons, and given a chance at life. Thank you.
Thank you so much, Jan and John and Donna, this evening. You know, I want to give an opportunity for people to ask any pressing question you have in the group tonight for Elizabeth or for Farah or for our NAMI partners who've agreed to answer questions this evening. But I really want to encourage you to actually stay. We'll only take a few minutes and we'll close. And since we're such a small group, they certainly will all be available, as well as myself, to answer any questions you might have one-on-one as well. I want to really encourage you to look at the materials on the back table. There's information about NAMI. Again, there are brochures back there. There's information about other activities during this month of action for Stepping Up. And if you're sure to sign into the sign-up sheet with your email, you'll also get the follow-up that Elizabeth talked about around all of the information we've gathered over the last 2 days about the assets and services we have in our communities throughout Mendocino County, as well as the significant gaps that we have. And our goal over the next several weeks is to put that information together, to really share that out here and with our other partners throughout the county so that we can better knit together the assets and strengths that we have and certainly that we can start to address and fill the significant gaps that we have. I'm constantly amazed by the resiliency of the consumers in our community, of the family members that we've heard from in NAMI tonight. And we're looking forward to doing this work and really taking these next steps through the Stepping Up initiative to move toward more recovery and wellness in our community. So if there are any questions, I'm going to invite Elizabeth up to say a few last words, and Daisy.
I do have a question. So I just want to thank you, three of you that shared. It's heartbreaking, but it's great to have a real story to the things that we're talking about. And specifically for on the coast, I guess my question is, where is this process specifically for the coast, or have we asked the questions for the coast, and have there been identified strategies for our services?
So, thank you, Daisy. So we actually took this afternoon, we had a bit smaller group here than we had in Ukiah yesterday, but we asked exactly the same questions through the service delivery questions that Elizabeth walked through, and we actually have all the notes. We already sent them back to the office to start to put them together. So it'll be great to have people like you and others look at what we collected today so far, really with a lens on the coast versus Ukiah and the greater county. Knowing that certainly when we see a gap in Ukiah, it's amplified as we come over to Fort Bragg typically, and amplified as we go out to more rural areas of the county. But that there are unique challenges here in Fort Bragg as well. So we did spend some time talking about the coast today, and certainly as we're looking at how to do this mapping, we'll be thinking about the geographical diversity of the county. Thank you for that question. I don't know, Elizabeth, anything you want to add to that? Around how people do mapping in this kind of geographically diverse areas.
Yeah, I think that, well, I mean, sort of as I said before, there's so many different ways to do it, and I think what is great about what's happening in Mendocino is they're really just kind of starting this, and I think that when this goes back out, kind of it will still be a draft. I think very much like just sort of, hey, this is what we gathered in kind of our 2 days, and what else are we missing, and you know, hopefully be able to do another like in-person session or something. Because when people sit down and look at it, it can raise different issues. But yeah, there's lots of different things that can come out of it.
Any other questions of our speakers for tonight from the group?
I have a thought. Out here on the coast, when somebody gets 5150, they wind up in the emergency room for 72 hours. Their emergency room is small. Maybe there's 2 nurses, 1 doctor, and maybe up to 4 patients who are there for 72-hour holds on the ER gurneys. And I mean, I had a personal experience in the ER. A number of other people have had personal experiences in the ER that have been clearly colored by this. I went in by ambulance for a cardiac issue, got onto the bed in ER. The ER nurse walks in and looks at me. I have a 3-day growth of beard. I'm a homeowner. I'm a retired educator. And barks in my face, "Did you hang yourself?" That was the first thing she said to me. And I, kind of recovered from it slowly. Fortunately, the paramedic was there, called it a shaving rash. I just have a kind of a sun rash from too many years of stuff. As I kind of recovered, I realized there was somebody in florid mental illness screaming and yelling that way down the hall, somebody else screaming and yelling that way down the hall, and no doubt this poor lady at 3 o'clock in the morning who'd been beat up since she started her shift looked at me and said, "Oh my God, not another one." And that's how she reacted.
I just want to say that the emergency department here in Fort Bragg, I think in all communities, emergency departments are a place where people go for all variety of health illnesses and health needs, and they are where people are often seen in our community during crisis. So it's a big discussion around the Behavioral Health Advisory Board, as well as Measure B around what other services, but certainly was identified could help, kind of help the emergency departments. But really, this is, again, what's been said all throughout the evening in the last 2 days, is helping people get to the appropriate level of care in whatever kind of crisis and state they are, and then helping the institutions like the emergency department. It came up a lot today around strengthening the supports that are there, the partnerships, the education and training for employees throughout all the places where we're touching people and trying to prevent incarceration, and also trying to make sure that people get connected with services. So certainly the emergency department here and working with the district hospital is on our list of gaps and assets to address here in Fort Bragg.
It's the place where the heel is grinding down.
Yeah.
And it's actually because the emergency department is where most of the community is seen first.
Yeah.
It has significantly contributed to the caustic narrative that is destroying our hospital. And so that's where my concern is, not my personal experience, but because it's wearing down the ER staff chronically.
Well, and I think this really important benefit that this community has to have local health care and a district hospital is really important for the health and well-being of the county.
It also needs local mental health care, inpatient mental health care outside of a trauma care facility.
Yes, and I think, again, that's a big discussion of all this effort coming in today. So if you signed up and if you want the email to kind of see how the mapping and the next steps come together, it'll come out of this.
I
And
did
Jan,
that. I just want to make sure it stays on the table.
yeah, thank you. Jan.
I just want to comment to your comments. And I think, I know that the Behavioral Health Board has representatives from all over the county, from each Missouri district. And I also have to serve on the Measure B committee because I'm the chair. And I know John has been really adamant that there needs to be a mental health facility here of some kind, which isn't something that the people in Ukiah at the Measure B meetings are really willing to address. So if you would like to come to the meeting and advocate, it would be a really good thing for this community.
And certainly those
Send me
ideas.
an invitation, but I can tell you right now, it's going to push something else off the plate.
All right, so I'm going to actually dismiss us for this evening, and thank you all very much for coming on this evening in Fort Bragg, and you're welcome to stay and talk afterwards. Thank you.